Okay, guys, you are welcome. This is Mr. John. You've been hearing for those who are in all my groups. For those who know me, this is me. And today we're going to be talking on test-taking strategies. You can apply these strategies in any examination you are preparing, whether you are a student nurse, whatever examination, whether you are preparing for a medical exam, you're preparing for a nursing exam, pharmacist, whatsoever. The strategies apply to all the examinations you are preparing. And in the UAE, most of us we're preparing for MOH, Ministry of Health and Prevention, Dubai Health Authority, Department of Health Abu Dhabi, and for those who are preparing for NCLEX US or UK-CBT. The strategies will help you. At the end of this presentation, I believe that your scores are going to improve if you will be able to understand what I'm going to be explaining here and you apply them as you prepare, as you answer past questions. I believe that you're going to discover an improvement in your scores. Wherever you think you need to go back to the video, I'm going to share the video on our usual YouTube channel. You can watch the video over and over and try to apply the strategies. I bet you will have some changes in the way you tackle your questions. Without much ado, let's move straight to the point. We're talking about examination question. The first thing you're trying to do is to try to understand the question that is in front of you. So what we have to do is you focus on the data or the information on the question, because this is what is important. You try to say, what is the question asking? What does the question want me to do? You look at the subject of the question and try to visualize the content. For those who are in the NCLEX group, I emphasize on the content. You have to understand the content of the material before you get into the question, because when you find a question in front of you, you should be able to visualize, though you are answering that question depending on what you find in front of you, depending on the data found in the question. But notwithstanding, you should have an idea of what that question is saying. You should know the medical condition that the question is saying in order to be able to answer the question. I will talk about you visualizing the event and you check within the lines, read the question within the lines, looking at every word. Now, when you are answering a question, we talk about consider available resources. When you read the question, assume that you have everything available around you to answer this question. Let me quote an example. You get into the patient's room. You should assume that you have the globes, you have the BP apparatus, you have everything around you to answer the question. You shouldn't think that you have to go out of the room to get something. Also, when you are answering a question, I have said this over and over, you are answering the question depending on what is in the books, the facts, the reality, not your experience on the field. This is why most people, they have difficulties preparing for UAE exam, depending on where you've practiced in the past. When you see a question, you try to think of what you were doing in your facility. No, questions are asking what are in the books. You should have that in mind. Yes, your present practice can help you to answer the question, like say, you have been coming across these scenarios, these medical conditions over and over. And if you are working in the facility that actually applies the real nursing procedure or laboratory procedure or midwifery whatsoever, if you happen to work in a facility that applies what is really in the books, you are you have higher chances of always making good use of your questions. I will explain more of this as we move ahead. Now, you have to, when you read a question, you look at the strategic words. There are words in the question. What is the first thing to do? What is the initial thing to do? What is the most? Words like this. These are strategic words which are very important when you read a question. Now, determine if the question presents a positive or a negative event quota. What does this mean? A positive event quota is like they give a scenario and they tell you to identify if the client understands what you're saying. Like you are explaining a discharge medical history to a patient who is going home, and you want to be sure if the patient understands what you just explained. So the question will ask you to pick out options that determines that the patient understands what you're saying. Okay, this is a positive event quorum. Now, negative event quorum, in a situations like they will ask you, pick out options that shows that you need further teaching, right? You explain something like a charge nurse is explaining about some procedures in the ward and so on, and she wants to understand if this new nurses do understand what she's saying, and maybe the new nurse says something that is not correct, and they ask you pick out a word that shows that you need further teaching, or the student nurse needs further understanding. So these are negative event quorum. Now, avoid what if. Yes, this goes a long way to what I explained before. Don't imagine that it is you are trying to answer the question depending on your experience, or like you are reasoning the medical condition and you're saying, what if it no? Look at the data in the question. Let me quote, for example, you get into the ward and you find a patient falls out of the bed, right? So what comes to your mind is like, I should put the patient back in bed, right? That's the first thing that comes to your mind. But when you read the question, what are the options? The first thing you need to do is to assess the airway, right, of the patient. The patient is there. You have to make sure that the patient is stabilized before you put the patient to bed. Okay, let's take another scenario. Okay, you get this same scenario and you think, I should call the doctor first, right? What if? No. So you should always read the question, try to understand what the question is saying, and apply your nursing judgment in answering the question. Let's look at the options. Now, you have gone through the question. Now you are reading the options. So we say, most important, always use the process of elimination. We are going to see questions that we apply the process of elimination. I like elimination. I think some of you like elimination. If actually you understand how to eliminate options, there are various ways to eliminate options. Options that are opposite, options that are comparable or alike. We're going to see those examples. You can eliminate them. Options that you are 100% sure that this cannot be the answer. So it narrows you to the options that maybe you eliminate two and you are left with two, and you start this two. Yeah, but it helps, right? By first of all, eliminating those that you are actually sure that they are not the right answer, okay? Now, you have to read the option carefully before eliminating. Reread the question. When you read the question, when you read the options, go back to the question before selecting, right? Look at comparable alike options and eliminate them. We are going to see what do we mean by comparable or alike. Determine whether there is an umbrella option. If there is an umbrella option, this could be the right answer. What do we mean by umbrella option? Let me quote an example. Okay. Let's say you talking about infection control, right? And let's take the example of standard precautions. We know that standard precautions will always apply whether you are using contact, airborne, droplet. First, standard precaution, then you move to whichever that you are using. So we say your patient, you have a patient in the ward, and this patient has, let's say, diarrhea. Which standard precaution will you apply? And you have options like droplet precaution, contact precaution, airborne, and then you have standard precautions and contact precaution. Can you get that? Diarrhea, we know that diarrhea is contact precaution. Option A says contact precaution. B says droplet. C says airborne. D says standard precautions and contact precautions. That is an umbrella option that includes other options in it. Okay, so this is likely to be the right option. Let's move ahead. Now, identify any close-ended words. Close-ended words. Yes, when you read a question, you read the option and they are close-ended words. What are these words? We are going to see them. Words like always, only. You get it? Yeah. In nursing, you don't say 100% is always. You don't say 100% is either always on the positive side or always in the negative side. There are some words that you use. You don't tell me that you always give normal, you should always administer normal saline 500 ml to a patient who is dehydrated. No, you don't use always. What have you determined? What have you taken into consideration? Is it a pediatric patient? Is it an adult? Do you know whether 500 ml will be fluid overload to this client or not? So you don't use always because the always will not necessarily go for every patient. So you don't use like only. So these are close-ended words that you identify in the option and eliminate them. We are going to see practical questions. Use the ABCs: airway, breathing, circulation, Maslow hierarchy of needs, nursing process. Yes. We all know, most of us, we always apply ABC, airway, breathing. But remember, not in all situations that the first priority will be airway. What happens in a situation where we have CPR, where you have to do compression, right? You have to do compression, airway, before breathing. So you have to take note of that. Now, use therapeutic communication, delegation, and have a guide. When you're answering pharmacology questions, you should have a guide on that. So these are the tips we're going to apply. We shall move now to see some strategy words. Like I said, what that indicate the need for prioritization. When you see this word, somebody's hand is up. Can you put down your hand? Bala CV. Yeah, it's not a time for you to ask any question. I'm doing the talking right now, okay? You will ask your question later. Now, when you see words like best, early, essential, these are words that should come to your mind. That means This question wants me to prioritize. And remember, when the question on prioritization is said, options, all options might be correct, but they want you to choose the best option, the priority question, the most option, the vital option, okay? So in priority questions, it's most likely that all the answers are correct. And this is where a lot of confusion comes in. You're like, okay, you tried elimination and you eliminated two, but you still have two. This one is right. This one is like, yeah, we're going to see that. That is, you have to pick out the best option. Let's look at again on strategy words that reflect assessment. When you see this word, you should have in mind that they're asking you to carry out an assessment. Okay, what like ascertain, to assess, to check. What will you check? The nurse determines that you monitor, you obtain information, you gather information, find out. These words are strategy words that reflect assessment. Okay, now we're just talking, it's not making any sense. But when we see a question and we apply all of this, this is where we try to understand what I'm saying. Question number one, let's practice now. Now, before we move to practicing the first question, I want to give some tips, some additional tips. Now, we've talked of eliminating, we talk of applying ABCs, Maslow hierarchy. We're going to see that the nursing process. We've talked about identifying words that determine prioritization, words that reflect assessment. Now, I want you to know that there are things you should avoid in answering some questions. Now, when you see the word first, not in all cases does it mean that it is an assessment. What will you do first? What will you do first? It doesn't mean in all cases, first does not mean assessment. Let me quote an example. Okay. A patient in room number D rings the call bell and you walk in and you find that this patient has difficulty breathing, you know, and you check the patient monitor, the vital signs, blood pressure is normal. I'm talking of objective values. You have values. Let's say 120 on 80, the heart rate is 16. I mean, the heart rate is 16 or 65, the respiration is 16, the oxygen is, let's say, 86. Take down of these objective values I'm giving you. And then the event query, the other part of the question says, I'm going to explain what you mean by event query. What will you do first? What will you do first? You have objective data in the event, in the stem, in the body of the question. Everything. And the first option says, administer oxygen as ordered. Monitor vital signs. Okay? That these two are okay. What will you do first? Now, in most cases, when you have a question with objective data, the option is likely to be an implementation and not necessarily the first step of the nursing process. Not necessarily checking vital signs. What will you be checking vital signs for? They have already given you data of the patient. You should implement. The next thing you have to do, depending on the value of the oxygen, 86%, you have to administer oxygen first. Applying the nursing process. The nursing process has assessment, analysis, or call it diagnosis, planning, implementation, and evaluation. When the question is asked where you have to apply the nursing process, remember when you are moving down from assessment to analysis, when the question already gives assessment of the client and the options has something that tells you to gather information or to assess. You don't have to choose that. You are moving to the next step of the nursing process. Either you are implementing or you are evaluating. You don't move up again. Okay, you don't move up again. I plan to do a separate video on Maslow's hierarchy of needs and the nursing process. And so that we have a lot of questions on that, because today we have a lot of steps to apply in answering questions, which these two alone need to have a video on its own. Okay, now I said first does not necessarily mean it has to be assessment. Second tips I want to give is most often try to assess the patient. What you are doing a nursing process, a nursing procedure. Don't always rush to carry out a medical procedure, okay? Now, when a patient has incomplete assessment data, that question is likely the option will be for you to assess. And before you call a medical doctor, make sure that you do something. You have to do something before calling for backup. And when a patient has incomplete data, you should assess. If it is a scenario that warrants you to call a medical doctor, before you call the medical doctor, you should have data to show that these are the vital signs of the clients before calling the doctor. Now, the next tip is action does not necessarily mean implementation. Okay, the stem of the question, a scenario is given, and then the question says, what action will the nurse take? No, you are now thinking that the action here, it means you should carry out an implementation. Not in all scenarios that action necessarily mean implementation. Let me give you a simple example. Now, you rush into the patient's room and you discover that the patient is having difficulty breathing, right? And the patient complains chest tightness, and they ask you, what action will the nurse carry? Okay. Now, option number one says, administer oxygen. Option number two says, check vital signs. Option number three says, these two are okay. Now, I brought in this question for you to understand that not in all cases you have to implement because of the word action. In this case, the data is not enough for you to carry an action. So what you have to do, you need more data to determine what to do next. You wouldn't, it's the chest tightness and difficulty breathing is not enough for you to administer oxygen. It's not enough for you to administer oxygen. You have to check pulse, check other vital signs, blood pressure, and so on. From the data gathered, you'll be able to see what next action to do or to call the doctor for further management. Question number one, let's go. What if? Avoid the what if syndrome. Question says, the nurse is changing the tapes on a tracheostomy tube, the client coughs and the tube is dislodged. What is the initial action? What is the initial action? We did tracheostomy some months ago on the YouTube, and our channel is there. When I will post this video, I will add the links of our previous videos so you can watch. Now, this question, I want you to just imagine yourself in the scene of action. You just watching, and the patient's tracheostomy tube is out. What comes to your mind? Just imagine the anxiety. Just imagine the confusion. I think the first thing you will want to do is like, right? Call the doctor. Let's be frank. Let's say before this class, if you were the one, or maybe you've had a situation like this, how did you manage it? So in most cases, most candidates would think the first thing to do, the initial thing to do, remember, we're talking about you looking at strategic words, which is initial here. The first thing to do here is to do what? Ventilate the client. That's the first thing to do. One moment, I want to get my a minute. Where is my video? I press something here. Excuse me, guys, I press something. Sharing suppose. Oh, shit. Are you still seeing my screen? Let me know if you're seeing my screen.
Yes, we can see your screen.
Okay. Okay, it's fine now. Okay, let's proceed. So in this question, what I was saying is that the first thing you might think is for you to call the doctor. That is not the first thing to do. The first thing, like this is trying to say, always avoid the notion of what if syndrome, comes in your mind. You should look at the question, read within the line, talking about tracheostomy client and where the tube is dislodged. What is the first thing to do? In this case, we have to ventilate. Now, when you choose an option, look at the option, look at the action that you want to do. Will this action help the client? If I waste time, what happens? When you read the options, now, when they set questions, they want you to be a safe nurse. Most of the questions, they're trying to test the ability in which you can practice as a safe healthcare professional without causing harm. So when you analyze each question one by one and try to visualize, if I do this, what happens? This will guide you to choosing the right options. Okay, let's try to look at our second question, which says, in this question, we are looking at the strategic words. The question reads, the home care nurse visits a client with chronic obstructive pulmonary disease who is on home oxygen at 2 liters per minute. The client respiratory rate is 22 breaths per minute. The client is complaining of increased dyspnea. The nurse should take which initial action? This is our concern. The first thing to do. Okay? Now, we have some objective data here. We know the respiratory rate, and we know that the client is on 2-liter oxygen. Okay? And our client is a patient of COPD. Dyspnea. Okay, let's look at the option. It says, determine the need to increase the oxygen. Okay, I explained already. Call the emergency service to come to the home. Okay. Reassure the client that there is no need to worry. Is this a good therapeutic communication as a healthcare professional? Don't give false assurance. Do not give false assurance. We are eliminating this one without wasting time. Collect more information about the client respiratory status. Okay. What's the answer? Please type in the chat box. Okay. Joshua, you change your mind? Okay. Please. What's the answer? Please, guys, what's the answer? Type your answer in the chat box. Do you know what the chat box is? Can you see it on your screen on your phone? Type to everyone. Don't type to me. Okay, King, good. Some say 4, some say 1, some say 2. Okay, let's see if we understand. Okay, let's go. King, you're right. The answer is 4. Why? The answer is 4. The initial thing to do, I said before, when you have a question that do not have enough objective data, it is likely that the option will be an assessment. Okay? There is not enough data for you to increase oxygen. And you don't increase oxygen as the nurse without the primary healthcare provider's order. Okay? Don't do that. There is no reason to call emergency service. That is not the first thing to do. That is not the first thing to do. The first thing to do is to assess this client by collecting more information. You have to assess this client before you call the emergency service or the primary healthcare provider, who will be able to determine if to increase the oxygen or not, or to take the next action. Look at the words initial. These words will guide you to the fourth option. Does that make some sense? Yes, Alpha, because the data is not enough to determine to increase the oxygen, and no need for you, it's not the first action to call emergency service. You have to do something. Second point, that number one is not correct. You do not increase oxygen without the primary healthcare provider's order. Okay, it's getting more interesting. Let's move on. Now, another tip that we can apply is subject of the question. When they ask a question, focus. We saw the second page of our presentation. Focus on the subject of the question. What is the subject of the question? It is the specific topic that question is asking about. The specific topic. You have to be able to identify the topic on which this question is talking about. And then you'll be able to find out what the question is asking you to do. Shall we practice? Let's go. Question number 3 says, the nurse should implement which measures to prevent infection in a hospitalized immunocompromised client? Select all that apply. This is the NCLEX question, style of question. Select all that apply. For the UAE, if they want you to choose 2 or more questions, they will tell you 1 or more option is correct. But most often they don't ask those questions, but they usually ask sometimes. It can come in your exam. Yeah, sometimes they ask. Now, we are talking about what? What is our topic? Subject of the question. Let's identify the subject of the question here. The subject of the question is prevention of infection, right? For whom? Immunocompromised clients. Remember, they did not use this word for nothing. It's not just ordinary infection control or just ordinary prevention of infection. It is prevention of infection in a hospitalized immunocompromised client, like cancer clients, clients undergoing chemotherapy, radiotherapy, HIV/AIDS clients whose immune system has been compromised, the immunity is low. When you are practicing infection control with these clients in your unit, they have specific measures to implement. So in this question, you have to identify the subject of the question. So what are the measures that we have to apply to prevent infection in a client whose immunity is compromised? Let's go. Use strict aseptic technique for all invasive procedure. Okay. Use good hand washing technique before touching the client. Okay. 5 methods of hand hygiene. Insert urinary catheter to eliminate the need to use bedpan. Okay. Keep fresh flowers and potted plants out of the client's room. Is it necessary? Okay. Place the client in semi-private room with another client who is immunocompromised. Semi-private. After this, go and read on infection prevention for immunocompromised clients, okay? Keep frequently use equipment such as blood pressure curve in the client's room. Okay, let's start. Let's apply, we can apply method of elimination. You eliminate those that you know that cannot be correct. So what this question is saying is for you to pick out the measures that you can implement in order to prevent infection for this client. And like I said, this client is not just an ordinary client, this is an immunocompromised client, and special measures are implemented to prevent infection for this type of clients. If you did not know, you are going to know right now. Point number 1, correct. Generally, use strict aseptic technique for all invasive procedure. Okay, this is fine for all clients. This is good. You have to do that. Number 2, use good hand washing technique. This is standard precaution, right? Remember the example I quoted before. Standard precaution will always go with all the other types of precaution. First, standard precaution, then you can decide to implement, is it contact, airborne or droplet, depending on the microorganisms. 2 is correct. 3, insert urinary catheter to eliminate the need to use bedpan. Like seriously, in the question, they have not said anything that this client cannot walk, cannot go out of bed, and you think you just insert a catheter because you don't want the client to use bedpan or to go to the washroom. More so, this client is an immunocompromised client. In this type of clients, always, by all means, avoid invasive procedures. By all means, avoid invasive procedures. In the hospital setting, the highest method for hospital-acquired infection is urinary catheters. If there is a way to avoid the use of urinary catheters, they should avoid. This is the highest method in which hospitalized clients get ascending infections. In immunocompromised clients, avoid IM by all means. Avoid invasive procedures by all means. 3 is wrong. Keep fresh flowers and potted plants out of the client's room. Did you know that? Yes, it's right. In this type of clients, you don't keep fresh flowers. Fresh flowers are bound to harbor microorganisms. You don't decorate the client's room with potted flowers and so on. No. This is strictly for this type of clients. 4 is correct. Place the client in a semi-private room with another client. No. These clients are strictly placed in private room, not semi-private. In private rooms, isolated. 5 is wrong. 6, keep frequently used equipment such as blood pressure cuff in the client's room for use by the clients. Yes. You don't take the BP out. You don't take the thermometer. You don't take equipment that are used for these clients are kept in the room. You use and you keep them there. You don't take it out of the room to be used or no, you don't do that. This is strictly for this type of clients. So 6 is correct. Now we are doing tips and we're like going to some details. You need to understand the content in order to apply. This tip is talking about subject of the question. You should be able to identify the subject and then you'll be able to pick out the options. We are going to see a situation where you don't know anything about the subject. You've been able to identify the subject, but you don't have the content of the topic. You should be able to apply some technique to get the right option. We're going to see that when we get to eliminating. Okay. Is it cool? Oh, we have some answers here. I did not give you the opportunity to send forth your answers. Some said 1 and 2. Nobody got it right. Okay. This is an NCLEX style question. Yeah, but most important, I wanted you to understand how to answer a question applying the subject of the question. Let's move forward. The next tip we are going to apply is positive and negative event quorum. I explained before already what this means. A positive event quorum uses strategy words that asks you to select an option that is correct. Positive. You should select the right option. For example, which statement by a client indicates an understanding of the side effect, right? Which statement by the students explain or gives understanding of the topic? Which statement by the patient gives an understanding of the discharge teaching? Which statement shows that the patient understand, these are positive event quorum. You can apply them in a lot of scenarios. This happens where you're giving education, you are teaching. You are teaching the client, you are teaching the nurses, the charge nurse giving talk. You apply these question types. They always come in this type of scenario. You most often, they ask you to select 1 or 2 options. So you look at the positive options, not the negative. Negative event quorum is just the opposite. Okay? Which statement by the client indicate a need for further teaching or a need for follow-up or shows that the client did not understand your teaching? Negative. So you are selecting the negative options. You gave a teaching to a client and you want to be sure of your teaching. And then the client says something. What is that thing that the client said that the client needs further teaching? That shows that the client does not understand. This is what we mean by negative event quorum. Let's not just say it. Let's practice something in order to cement this point, right? Right on, we're going. Yes. Let's look at this. I will give you the opportunity to text your answer options. The question says, the nurse is teaching a postpartum woman how to bathe her newborn. The nurse should provide which instructions to the mother? Yeah, I said this question, they always ask 2 or more options when they're talking about teaching, yeah. First, apply your subject. The subject is bathing a newborn. Bathing. So what will you teach the mother on how to bathe a newborn? what are the instructions that you're going to give on how to bathe a newborn? Can you reflect maternity nursing in nursing school? Practicals, right? The first time you go to the maternity ward and you have to bathe the baby, you hold the newborn like the baby's trying to fall off your hand. You can recall that, right? And you just finish the newborn care in class and you move now to the ward to practice. Your first time to hold a newborn baby. It's like that baby will fall off your hand. Some lecturer, somebody will slap you. Or... Okay, guys, let's go. What's the answer? Yes. Someone say 1, 2, 3. Someone say 1. Yeah, remember talking about select all that applies. Now, in the NCLEX, select all that apply can be just one option, or it can be all the options. Yes, can be just one option, or it can be all the options, or it can be 1, 2, 3. That's it. Now, you need some content to understand it. You need to know where's this coming from? Okay, I've seen your answers. Yes. Can someone have it rightly? Can someone have it rightly? Okay, let's go. Support the newborn's body during the bath. Yes, of course. You will have to support, right? That is clear. Correct. Let's go. Clean any eye discharge using wet cotton ball. Wet cotton ball. Do we use wet cotton ball? Yes, we use wet cotton ball. Fill the bathtub with more than 10 inches of water. No, this is wrong. Clean the eyes moving from the outer contours to the inner contour. Like seriously, you clean like this or like this? Yeah, first wrong. You clean from the inner to the outer, not the other way around. Cover the newborn's body except for the part being washed and rinsed. Yes, you have to maintain the body's temperature. So you cover the newborn, you start with the face and the head, you move to the body, and then you go to the legs, and then you finish with the groin, okay? You clean the groin and the diaper area, the anus last, okay? So 5 and 6, from my explanation, 6 is wrong. So you cover the newborn except the part being washed and rinsed. Yes, correct. Begin the bath with face and clean the newborn's diaper area next. Be careful. They say next. They did not say last. They say next. So meaning to say from the face to the diaper. No, that's not the procedure. From the face, the head, the body, down to the legs, the groin, you end with the diaper area last. That's why we say, read your options, read within the line. You see what that one word can do for you? And if the answer is 1, 2, 5, and then you add 6, when you choose a wrong option, the whole question is wrong. They don't give 0.5 or 0.75 marks, no. If you had to choose 1, 2, and 5, and you choose 1, 2, is wrong. You have to choose all the right options to be able to earn a mark. So this question is about positive event quorum. They want you to pick out the positive teachings. Let's look at the negative event quorum. The nurse provides home care instructions to a client who is taking lithium carbonates. Which statement by the client indicate a need for further instructions? Further instruction. Meaning the client said something that is not right, and you have to correct the client. And that is what you have to choose, right? Now, this question will require you to understand the content. Lithium is a mood stabilizer that is administered for clients with bipolar disorders, okay? And you have to observe the clients who is taking lithium on toxicity, because the client can present with signs and symptoms that shows that there's overdose. Now, this question will require you to understand the content, but what I want us to apply in this question is how to be able to identify what the question is asking me. The question is asking you to choose the option that is wrong. Yeah, that is wrong. So I need to take the medication with meals. My blood levels must be monitored closely. Okay, we're going to see, I said, make sure you look at the words that have close-ended words, questions, options that have close-ended words. Like this is a close-ended word, must. In nursing, you don't use those words. Must, only. I need to decrease my salt and fluid intake while taking the medication. Decrease salt. I need to call my doctor if I have excessive diarrhea, vomiting. Yes, these are signs and symptoms of lithium toxicity. I need to take, you can take this medication with meals. It's right, it's fine. You will need to call the doctor if you experience this. Now, this medication is toxic to an extent that when a client is on this medication, we have to monitor the blood pressure. Now, here it says decrease. When a patient is on lithium, lithium depletes sodium. So the patient has to maintain a certain amount of sodium. The patient will not need to decrease, the patient will have to maintain, you have to increase fluid and maintain sodium. So this statement is wrong. Remember, we are choosing the option that needs further teaching. We are choosing the option that needs further teaching. So in the client that is taking lithium carbonate, we have to increase sodium, increase fluid. We don't have to decrease. So these other options are correct, but that is not what they are asking. If it were a positive event quorum, what will you teach? It will be 1, 2, and 4. But they say identify the statement that needs further instruction, the statement that is wrong, the statement that is incorrect. 3 is incorrect because we don't decrease salt. We don't decrease fluid when a client is on lithium, subject of the question. Further instruction. Okay, that is that. Someone asked a question. I think I answered that question already. I don't know if you still have doubt in that question. Angel. I answered that question already. Okay. Let's move forward. I'll try to be a little bit faster. We're going to go, I told you we'll go an hour plus, okay? An hour plus. Still showing that. It's not erasing. Don't mind. So the next thing we're going to look at is questions that require prioritization. We're going to talk about that. I want you to know 3 important things. When you're answering questions that require prioritization, apply ABCs, apply Maslow hierarchy of needs, apply the nursing process. You're going to see how you apply these 3 steps in answering questions that require prioritization. Also, take note of strategic words that determine prioritization. You saw those words. First, initial. Okay, those words, they determine prioritization. So we're going to see, let's practice some questions by applying ABCs, Maslow hierarchy, and the nursing process. Now, in the nursing process, I said the first step is assessment. Second step is analysis or diagnosis. Then you move to planning, implementation, and evaluation. In the Maslow hierarchy, there's what we call the Maslow hierarchy tree. Okay. Now, this priority at the base, these items at the base, these are the priority needs for the clients: airway, nutrition, voiding, the heart rate, the vital signs. And then you move to safety and security, love, belonging, self-esteem, and self-actualization. I'm going to make a special video only on this, and we're going to practice many questions on how to apply Maslow hierarchy of needs, okay? Today, we will just have few questions on that, and then we move forward. Can you mute yourself? Who is that? I think I muted everybody. Did you unmute yourself? Now, when we're doing Maslow hierarchy, the priority is physiological needs, which are airway, breathing, respiration, blood pressure, nutrition, okay, voiding, elimination. These are the basic. Next is safety and security. Safety, the nurse and client relationship. Safety from injuries. So when you're answering questions and you see options that have words like this mentioned, you should reflect that this question, I have to answer it using Maslow's hierarchy of needs. So Am I going to self-actualization, or I'm looking at physiological needs first? Always what? Physiological needs. Then we move to safety and security, and then we move forward. Not the opposite, from the base, going up from the base, the one with the broad base, the priority. Okay, let's practice a question applying ABCs. I have mentioned in this presentation several times, not in all scenarios that you have to apply ABCs. When a scenario indicates an emergency, it is likely to be an implementation. Okay? If the scenario is about CPR, it is likely to be compression. I'm quoting ABC and nursing process, just for you to understand that it is not in all situations. You have to apply the order as it is. In ABC, if you have to carry out CPR, then we have to compress first before looking at the airway. In the nursing process, if it is an emergency, we have to implement before assessing. Take note of these 2 points. Let's write on. A client is admitted to the emergency department with complaints of severe chest pain. The client is extremely restless, frightened, dyspneic. Immediate admission prescription include oxygen by nasal cannula, 4 liters per minute, troponin, creatinine phosphokinase, isoenzymes, blood levels, isoenzyme blood levels, a chest x-ray, 12-lead ECG. Which action should the nurse take first? Okay, you have to identify subject of the question, strategic words. Strategic word, what to do first. The client is complaining of chest pain. We have a lot of prescription, a lot of activity to carry. This question can be flipped the other way around. There are questions in NCLEX, they call them drag and drop. Drag and drop. They can bring this scenario and then they describe and they tell you, arrange the following actions in the right order. Which one to do first? The same question can be asked in another way. So, let me see how I can mute this person. Who is this person? Okay, I think I got it. Yalla, sound disappear. Okay. So, this patient is extremely restless and fatigued and dyspneic and has been ordered a lot of things to do. What will you do as a nurse? 1, obtain the 12-lead ECG, draw blood specimen, apply the oxygen, call radiology department. What's the right option? This one is simple and direct. Okay, I'm seeing the answers. Mr. John, why are you bringing simple question? Because I want you to apply the technique. Apply the technique. It might be simple now because I've explained over and over, But if you do not have this technique and you are faced in this situation and the question is in front of you with the examination tension, you will likely choose something than what you are choosing right now after this explanation. Yes, you all got it right. Perfect, 100%. The answer is apply oxygen. Many are still joining. Wow. Wow. I said today's fire. Apply oxygen. So ABC says airway first. You have to maintain the client's airway. The rest can go in any order depending. Can draw the blood, can do the ECG later. Airways first. Let's move on. This one has been explained. Question number 7. We're applying Maslow's hierarchy of needs here. I want you to be able to understand how to answer questions by applying Maslow's hierarchy of needs. The question says, a female client arrives at the emergency department and states that she was just raped. Sorry about that. In preparing a plan of care, which is the priority intervention? This is a rape case. Try to visualize what this client is going through. Psychological, emotional, physical trauma, all combined on this client. And you have to apply a holistic approach in taking care of this client. But what is the priority? I could remove the word priority and say, what is your first intervention? What is the most thing you're going to do? Remember, we saw words that determine prioritization. Always try to think of this word. Here is clear, they just use the word directly. They could have used, they just say priority. They could have used other words. It is love for you to be able to identify that this question is a prioritization question. And to answer prioritization question, look at it. Am I applying ABCs? Am I applying Maslow hierarchy? Am I applying nursing process? Let's go. So we say, the options say, providing instruction for medical follow-up. The priority intervention is to provide instruction. Okay, let's go. Obtaining appropriate counseling for the victim. Counseling. What is counseling? According to Maslow hierarchy of needs. Okay. What's counseling? A psychosocial. A psychosocial. Right? Goes to self-love and belonging, self-esteem, self-actualization. What are you trying to look? We are looking at, you should be looking at physiological need. If you don't have, you move to the next. What am I looking for? I'm looking for safety and security. Option 3 says, providing anticipatory guidance for police investigations and medical suggestions. Is that the first thing to do? Is that the first thing to do? Let's go. Exploring safety concerns by obtaining permission to notify significant others who can provide shelter. who can provide shelter, safety concerns. 2, counseling. So where are we at Maslow's hierarchy of needs? Okay, I'm seeing your options. Send them forth. Some say 4, some say 1, some say 2. Tell me your answer. What do you think? Are we understanding the concept? More are still joining. Oh my God. Okay. Following Maslow hierarchy of need, we're not able to identify any physiological needs in the options. We move to the next step. The next step is security, safety and security. So question 4, option 4 is asking us to take the action to safeguard these clients. The first thing in this question is for us, to attend to the physical trauma and so on, which falls under physiological needs. But we don't have that in the options. That's the first thing to do. Okay? Attend to the physical trauma of these clients. And we don't have that in the option. The next option is telling us about safety. That is the one we have to go in for. Most we think we have to provide counseling. Yes, counseling is good, but according to Maslow, counseling is not a priority at this moment. Remember, when all these options are correct, I said before, when you're answering prioritization questions, the options are likely to be correct, but which one is the most? Which one is the best? This is the problem with exam. We are stuck somewhere. Oh, this one is right. Oh, this one is right. I think all are right. All are correct. But which is the best? Which is the most? The first thing for you to do, follow the hierarchy and you move forward. That's why I'm here today, to make you to understand how to apply these tips in answering these questions. So number 4 is right. Let's look at a question that we have to apply the nursing process. Remember, we are still answering prioritization question. We answer a question applying ABCs. We answer a question using Maslow hierarchy. We are answering a question using the nursing process. In the nursing process, we are going to answer a question applying assessment and another question applying implementation. Excuse me. We will not be able to answer practice questions applying all the various steps of the nursing process. Like I said, I plan to make a separate video on Maslow hierarchy and the nursing process where we will be able to practice a lot of questions. Okay. The question reads, the clinic nurse prepares to develop a diabetic teaching program. To meet the client's needs, the nurse should take with action first. Strategic words that reflect assessment. We saw that, right? Strategic words that reflect assessment. Prioritization. So our client is a diabetic client, and what we're doing, we want to give teaching. So the priority says, what should we do first? We're preparing a plan a teaching program. You have clients. But just visualize, what do you have to do first? Try to think. In nursing, you want to draw a plan. Do you need to involve me? Do you need to assess my understanding of some aspect to be able to know what to draw? Do you need to include family members? Who do you need? You have to work as a team. Should I just go draw a plan for you and come? This is your plan. This is what we're going to. No. You have to assess something first. You have to involve the clients, if possible. Family members, especially in home care clients. It's a clue for you to be able to pick out the right answer in this question. So like, I'm visualizing, I am reflecting, I'm imagining. So when you read a question, you have few seconds to flip over this question and look at the scene, what is happening before you take an action. Option says, assess the client's functional abilities. 2 says, ensure that the insurance will pay for participation in the program. What's the first thing you have to do? 3 says, discuss the focus of the program with the interprofessional team. Is that the first thing to do? I don't know. Include everyone who comes into the clinic in the teaching session. Everyone, close-ended words. We're going to see them. Everyone. Why should I include everyone who comes to the clinic? If you are not concerned with the client, why should I include everyone? We eliminate this first before going forward. Insurance. Are we talking about insurance now? Is it the first thing to do? No. I've helped you to answer the question. What are your answers? Oh, everybody is getting it correct. Oh, yay, this is becoming so interesting. Yay, this is cool. Everybody's getting it correct. Okay. Congratulations, guys. I think we're moving. So, words we said in the words, strategic words that reflect assessment. Assessment itself, right? Question 1, assess. So this is a question on assessment. And option number 1 says assess, then that should be the right option. You have to look at it. The first thing to do, the nursing process, what's the first thing? Assess. Assess. So you assess the client's functional abilities for you to be able to prepare a good teaching plan for this client. Guys, after this class, go back and watch this video over and over and try to apply it as you answer questions. You might not be able to understand at the end of this class. When you what is wrong, I know. I intentionally prepared all of this. I know that this class will be long, but it's necessary. Question 1 is correct. Let's move forward. Evaluation. We're still on the nursing process. The nurse instructs a client receiving external radiation therapy about skin care Which statement by the client indicates an understanding of the instruction? Select all that apply. This question is a positive event question. Why do I say so? We saw positive event, right? An understanding. They're asking you to choose the options that shows that the client understands the instructions that you gave. And subject of the question, external radiation. So now, by identifying the subject of the question and what the question is asking, you should be able now to visualize and be able to pick out the options. If you have not read about radiation, go and read about radiation after this class. Notwithstanding, let's apply our nursing process of evaluation to answer this question. So when a positive event quorum is like evaluating, like I said before, you have given instructions, you have given teachings, you want to evaluate if the teaching is successful. You want to evaluate if the teaching is successful. So we are applying the last steps of the nursing process in answering this question. Let's go. I can lie in the sun as long as I limit the time to 2 hours. No, a client receiving radiation therapy, you don't do that. You don't lie, you prevent. If you happen to go to the sun, you have to use sunscreen, you have to wear clothing that cover yourself. The time limit should not deceive you. 2 hours, no. You can fall for that. They say, oh, sir, it says only 2 hours. No. 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 I should wear snook clothing to support the irradiated skin area. Now, this is the problem. Now it's English. Is it English or what? So we are going to miss this option because we don't understand what's the meaning of snook clothing. Okay, let me break it down. Snook clothing here, they're talking about tight-fitting clothing. Okay? This American, this is just confused because with just one word. Don't mind, I'm just joking. Yeah, so a client who is on external radiation should not wear tight-fitting clothing, should not, okay? Wear loose clothing. So this is wrong. This one is wrong. Remember, we are looking for positive event query. We are looking for statements that indicate an understanding. Don't choose, these are not the right ones. This is not what we are looking for. So we're eliminating these ones. These are the wrong ones. We eliminate them. I should wash the irradiated area gently each day with a mild soap and water. Yes, you see what, like gently. Mild soap. Okay, this is correct. After bathing, I should dry the area with a parting motion using clean soft towel. Soft towel. Parting motion. Parting, like, you know, not rough, you know, not like this. Parting. You don't want to peel off, like in some cases they have some patches there. So this statement is right. You should, after bathing, dry the area with a parting motion using a soft towel, not a rough towel, not you know, vigorously. No, those words, you have to eliminate them. So 4 is correct. I should avoid the use of powders, lotions, cream, skin. Yep. Correct. You don't use lotion, creams on the skin of a client undergoing radiation. So this is a right state. This is a correct statement. Okay. Remember, we are selecting statements that options that show correct statements. So it's right. It's fine. I should avoid removing the markings on the skin when bathing until my course of radiation is complete. Yes. Don't remove until clients undergoing radiation, they have sessions, right? They have sessions. Don't remove the marking until your sessions are over. Don't remove. So the right answer, remember the question is a select all that apply, 2 or more options. Please read and reread your question. Don't rush. You have about 1 minute, 30 seconds per question. So 3, 4, 5, and 6 are the right options. Did anyone get it? 3, 4, 5. Oh, Joshua, you missed 5. That was a good try. But at the end, you still fail. Even if you give 3 options and you miss 1, you still fail the question. That's how it is. Let's move on. This is another tip that we have to apply in answering questions. Determine if abnormalities exist. This is mostly in questions that have to do with laboratory values, and drug toxicity, overdoses, and emergency situations. You always have to use the technique of determining if abnormalities exist in the question. That is likely to be the right option. What do we mean? Like we've seen questions like ABGs, lab values, and then all the values, most of the they are all correct, then one is wrong. It's likely that is the one they are asking, right? Or they ask you which of the lab values shows that this medication is effective. Yes, you might have seen questions like that. It's effective. Then you should be looking at the lab value that has gone to normal, right? Other lab values are still high, very high. Then you look at the one that has gone to normal. So let's practice this question using the technique of identifying if abnormalities exist. The nurse is caring for a client who is taking digoxin and is complaining of nausea. The nurse gathers additional assessment data and checks the most recent lab result. Which laboratory value requires the need for follow-up by the clients? Yes, need for follow-up. This is a negative event quorum. It means something is wrong. I have to do something. So you are looking at the value that is abnormal in order to intervene. Okay? Sodium 138, potassium 3.3, phosphorus 3.1, magnesium 1.8. So in this question, we have to master lab values. You cannot answer this question without knowing your lab values. Okay? Sodium, we say, is 135 to 145. Potassium should be 3.5 to 5.0. In that case, we already see potassium is low. What about phosphorus? What about magnesium? Some people are going out and coming back. So we'll try to be a little bit fast. we're almost consuming 2 hours, and I still have enough. Let me know if you guys are tired. Let me know if you guys are tired, then we will have to continue. We will take the other part to a different video. Are we tired? Yeah, before we proceed, the option here is 2. Potassium is out of value, it's low. It's low. So you answer this question, the others that are within normal range. They are all within normal range. So we answer this question by determining if abnormalities exist. Can you text? Just text, tell me, let me know if you guys are tired, if we have to end this session. Many people are still following up. In some classes, people will check out. We were 27, we are still 21. It shows how important the class is and how determined you guys are. And I do appreciate that. I do appreciate. Wow. For keeping you guys for close to 2 hours. That's awesome. I hope you're enjoying it. This is damn awesome, guys. 2 hours. Wow. You guys are still there. It's damn cool, man. Okay, I will be a bit faster. We're still on determining abnormalities. Let's get this one. The nurse is providing discharge instructions to a client with diabetes mellitus, and the client's glycosylated hemoglobin levels is 10. How should the nurse inform the client? Okay, guys, this question will determine you, like I said before, to know lab values. So if you know the lab values, you will be able to answer this type of question. Now, most questions that often come on these, as you might have seen, there are questions on HbA1c is the lab test to determine how the client's blood sugar has been within the 3 to 5 months, right? This is the common question that comes on this. You're surprised to see this one today. Yep. Now, the HbA1c has a value determined on whether the client is a diabetic client or is a non-diabetic client, okay? For non-diabetic clients, the value should be less than 4 to 5%. For diabetic clients, it should be less than 7%. Saunders says less than 6%. So you need this knowledge to be able to answer this question if abnormalities do exist. So after getting this information, I've given you what will be the right option. How should the nurse inform the client, depending on the lab values? Remember, as a nurse, you have to know lab values. There are abnormal values and there are critical values. A value can be abnormal, but it is not critical. That's for another class. So, increase the amount of vegetables and water intake in your diet regimen. Change the time. So here, this value is abnormal, it's high. This is diabetic clients. It should be less than 7%, okay? So this is already high, you've identified that. So what should you tell the client? Change the time of the day you exercise because it may cause hypoglycemia. No, the time you exercise has nothing to do. Continue with the same diet and exercise regimen you are currently using. No, it's high, you have to do something. It's high. You cannot continue with the same regimen. Utilize high intensity exercise regimen and decrease carbohydrate consumption. No, when you increase, you are likely to instead cause this client to go to hypoglycemic state. Yeah, this client instead go. So the client blood sugar is high. What we should tell the client instead is to increase vegetables and water intake, okay, in the diet. This will drop the blood sugar level a little bit, okay? So the answer here is number 1. You can only answer this question if you understand that there is an abnormality. But if you think the value is normal, you will not be able, you will go like choose option 3, right? So this is what you have to apply in order to answer such questions. Let's move. This is one of the best. This is one of the best. I always apply this. One of the best, guys. There are some people in waiting room. Let me. Okay. I've unmuted you guys. Another tip we can use is eliminate comparable or alike options. Comparable or alike options, you eliminate them. And then you are left with others that you can now decide which option is right. Let's look at this. The nurse is assessing the leg pain of a client who has just undergone right femoral popliteal artery bypass grafting. Which question will be most useful in determining whether the client is experiencing a graft occlusion? This is a client who has been applied a graft, and we want to determine if this client is experiencing a graft occlusion. You need some content in order to understand this question, but let's apply the knowledge of elimination to make it easy for us to answer this question. Let me tell you how to use it. Option number 1, can you describe what the pain feels like? Okay, look at it. Look at option number 2 again. Can you rate the pain on a scale of 1 to 10? Comparable means they are saying the same thing in meaning or in words. If you see a question of they are all increasing, they cannot be all increasing, they are comparable. Or I use decrease, and then the other option you say reduce. They are saying the same thing. So these options are likely to be the wrong options. You have to eliminate them. Did you get any relief from the last dose of pain medication? Option 1 to 3, they are assessing pain. These are methods of scaling pain assessment. They are saying the same thing. Can you describe the pain, how you feel? Can you rate your pain? So these options are comparable or alike. You can eliminate them. And you are left with number 4. Can you compare this pain to the pain you felt before surgery, so that you'll be able to know if there is an occlusion or not? Let's say you did not have a clue of the content of this question. You could answer this question by applying the method of eliminating comparable or alike options. Okay, that's what this option is talking about. Let's practice another one about eliminating. comparable or alike. The nurse manager reviewing the purposes of applying restraint to a client determines that further education is necessary when a nursing staff member makes which statement supporting the use of restraint. Yeah, this is a client on restraint. So we are looking at options that require further teaching. This is a negative event quorum. Okay? The nurse manager has given education on the purposes of applying, and he wants to know if the client understands. But the client said something that shows that further education is necessary. That is what we are looking for. But we will answer this question by applying, by eliminating comparable or alike options. Okay, let's look at it. It limits movement of a limb during painful procedure. Okay, is this the purpose of restraint? It prevents the violent client from injury, self, and others. At night, it keeps the client in bed instead of wandering about. It is useful in preventing the client from pulling out intravenous lines. Now, for you to know that restraint are not applied just unnecessarily because you think you should apply. Restraint are actually ordered, they are prescribed only in situations that they are necessary. Like when you deduce that the clients can cause harm to self or others. That is when you can apply restraint. Now, which of the options are comparable? Number one says it limits the movement of the limb. That is not a purpose of restraint. But number one and number four, they are saying the same thing. If you limit the movement of the limb, then the patient is also not able to pull out intravenous lines, right? This is not the purpose of restraint. So number one and number four are saying the same thing. They are saying the same thing. They're saying the same thing. So we have eliminated 1 and 4. At night, it keeps the client in bed. That is not a purpose. You don't apply restraint because you want to prevent the client from moving, no. So the answer is 2. We were able to eliminate 1 and 4 because they are comparable. We are left with 2 and 3, knowing willfully that restraint are actually applied if the client is about injuring self or others. This will lead you to the right answer. Okay, guys. We have been talking for 2 hours and we have a YouTube channel. It is still new. It is still, it's a young page that we are trying to grow. And if this lesson is important for you, please check on YouTube and subscribe to our channel. Nurses Corner Net is the education channel only for nursing stuff. Healthcare Consulting is where we post everything about what we do. Healthcare placement in the UAE, in the US, the NCLEX process. If there are any developments, we post them on Healthcare Consulting. But the Nurses Corner Net are videos about nursing exam answering questions. So please, guys, let's use this week to carry the channel to 500 subscribers. If you are watching this from a laptop, just use your phone and search and subscribe. Click the notification button so that when we post, you'll be able to receive notification. If you are on duty or you are where you have your friend, collect your friend phone and, and subscribe for the friend. Just say, my friend, please, you have to subscribe. Just get a phone, go to YouTube and subscribe for the friend. Also share the videos to your friends. Comment, let us know what you want us to discuss. We're just growing the channel. Help us to grow the channel. Okay? We should grow it together so that we can make nice content for you guys. With this, I will come to the end of this presentation. The other part, which is one of the best, will go to another video. Oh, it's damn long. I know. Today, we've been talking. I will do this in part 2 of it. Yep, I will do it for the part 2. Today, we're going to end here. You can unmute yourself and talk to us. Unmute yourself and talk to us, guys. Unmute yourself and talk to us. Yes, I've unmuted all of you.
Yeah. Thank you so much, Mr. John. It's been a wonderful one. I thank you so much. It's very, very unfolded. This is a wonderful knowledge. Thank you for keeping us busy for 2 hours, and this is all inspiring. Thank you. God bless you, sir.
Thank you, Dr. Amiara. Thank you for staying with me for 2 hours. Oh my God, I'm honored. This is huge. If it were not interesting, you guys would have left. Come on.
Thanks.
This is huge. 2 hours of continuous talking. And you guys just sit there. I'm honored, guys. I'm honored. Talk to us. Tell us your name and where you are joining from. Raise your hand and Signa if you want to talk. And the take-home affirmation for today. Yes, B-Tech, go ahead. B-Tech, you raise your hand.
Good evening, everyone.
Good evening.
I trust we all are great. So thank you so much for this class. Thank you so much. I don't even know what to say. Thank you so much. I'm watching from the UAE, Dubai to be precise.
Welcome. How's UAE this evening? I'm in Dubai.
I'm great. I'm great. Dubai is great as well.
Thank you. You're welcome.
Thank you, sir.
I'm glad you enjoyed the class.
Yeah, thank you.
That we're going to post it on YouTube. Comment, tell us what you want us to discuss next, and share it with your friends. Thank you.
Okay, so thank you.
Who is next? So you have to say, you are a conqueror. Okay? Say, I am a conqueror. I engage to conquer. I'm engaging into the DOH process. I'm engaging into the MOH process. I'm engaging into the DHA. I'm engaging into the NCLEX process to conquer. God help me. I will conquer. Okay, you can take a picture of that. That is the affirmation for today. Okay, if who wants to say something? If you don't have anything to say, then we will end the class here. Thank you guys so much. So you've been listening to Mr. John. I am the CEO and founder of Amgen Healthcare Consulting. Most of you know what we do. We carry out the UAE licensing process, the NCLEX process. We also give coaching, and I will be honored if you share our work with your friends, please. Most of you, we have some, yes, Panya, I will give you the, I've seen your hand. We have some videos on YouTube. We've done videos on tracheostomy, on chest tubes. Most of you have watched the videos and you testify that it helped you in your exam, but that is not enough. Comment, drop your comment. Others will see, subscribe. Most of you have told me, I discover your video on YouTube. Thank you so much. I do appreciate. Share, comment, say something, like. Okay, Tanya, right on. This class is very long, and someone is instead saying that it should be longer, it should go beyond 2 hours. Like, seriously? What? Okay, thank you. I'm reading your comments in the chat box. Yeah, I'm reading your comments. Panya, your hand was up. You wanted to say something. Yeah, thank you guys. I'm honored. I'm seeing your comments.
Hello, everyone. Good evening.
Hello, good evening.
Yeah, Mr. John, thank you very much for the class. I've been following from the beginning, though my network has not been the best, and I've learned a lot today, as I can say. Thank you very much. I am a conqueror.
You're welcome. Yes, you are. Yes, you are. You are. You are. You should affirm that. Yeah, I see you going, checking out and coming in. I discovered that your network should be having a problem.
Yeah, my network has not been the best.
Okay. Without any other person, I will say thank you so much, and we end here for today. Thank you guys. Thank you guys so much. Thank you so much. We're ending here for today.